Welcome to the Darcy Wellness Show. My name is Geoff Darcy. I'm acupuncturist, herbalist, and director at the Darcy Wellness Clinic in Natick. And we're doing a show today on back care, how to keep your back healthy and strong at work, and to try to prevent the suffering of work-related injury. And with me in the studio today is Betty Wu, acupuncturist and craniosacral therapist, and Dr. Pheng Kouch, chiropractic extraordinaire. And today we're going to be talking about back care and back pain as it relates to work-related injuries. And if we could kick off by going to our first slide, some of the statistics are pretty amazing out there. About 85% of Americans experience back trouble by the age of 50. Back problems are the most frequent cause of activity limitations in work-age adults, and also in the long run, surgery, chiropractic care are considered, effective, but really the conservative approach is always the best approach for us. So, Dr. Kouch, the idea of preventing somebody from surgery. For instance, we were working in our corporate wellness program with somebody who had really bad back pain and was heading towards surgery. And with acupuncture and chiropractic, she was able to avoid a $40,000 procedure of back surgery. So how common is that? How common do you think that in your practice you're able to prevent somebody from heading towards surgery?
It's kind of a difficult question to answer, but I understand where you're kind of going with this. Patients who don't see relief, those are the people who get frustrated and eventually go to go get surgery.
Right.
If we're able to help them out and help them manage their symptoms with the acupuncture, with the chiropractic, and with massage and with exercises and the like, those people are much less likely to go get surgery, which oftentimes is ineffective in the first place.
So, for instance, there was a Canadian study where what they did is they filtered everybody with back care through first through 10 acupuncture treatments and then through 10 chiropractic treatments, and then they went on into surgery. The remainder went on to surgery, and what they found was that 33% were, the acupuncture was effective for 33%. So acupuncture prevented 33% of people going towards surgery. Then the other 33% were, roughly about 33%, were prevented from surgery with chiropractic. So in the end, just 1/3 went through to have surgical procedures. And a lot of times, right, the idea is that if, like you say, if people are out of pain and they're comfortable, then they're not really pushing their doctors to go to the next step with surgery. If we could go to our next slide, a lot of these work-related injuries are actually caused by bad workplace design and engineering. So the idea of safer lifting equipment, avoiding very high or very low object placement if you're moving stuff from the shelf repeatedly in your workplace, or reducing object weight and size just so the sudden strain on the back isn't as strong as it might be, eliminating the need for twisting motions, eliminating bending and stooped postures by providing having mechanical assistance. So basically in the workplace, you can prevent a lot of injuries that would come through into chiropractic and come through into acupuncture practice. So, Betty, how many office workers you treat a lot with acupuncture, a lot of repetitive motion disorders and different back problems with acupuncture? How many of those injuries do you think you're able to help in general? That's a broad question.
I think it depends on the individual that comes in, how much time they have, finances, and patience.
Yeah.
But in the end, if they stay patient and follow through with 12 visits, we can pretty much improve the condition by 80 to 90%.
80 to 90%.
Yes.
So just give everybody out there a sense of what that looks like. So an office worker has a bad setup with typing and has maybe some repetitive motion, inflammation, pain. What does it look like? How does it start to make an appointment with you? What happens?
Well, they usually give us a call, and
Yeah.
they always ask, does it work?
Yeah.
And I would say, absolutely, it does work. Research have shown that with acupuncture, it can promote chemical steroids and endorphins, therefore decreasing inflammation as well as stopping the pain.
Yeah.
So then we can go ahead and increase the circulation so that it can heal.
Right. So what would that look like? So they call you, you do an examination,
Yep.
and then you figure out a plan?
Yep.
What does the examination look like for acupuncture
Well,
when they
first-
come in with repetitive motion, say?
They'll come in and they'll let me know what it is that they come in for. So, for
Yeah.
example, if it's carpal tunnel, I will observe the area, also observe the body, because
Yeah.
that can tell me their constitutional health. And that will help me also determine whether it's going to take more than 12
Yeah.
treatment or maybe 6.
Yeah.
So the healthier they are, in terms of the observation, what I see, the quicker the recovery. So usually I will do the intake on that day and give them a treatment on that day.
Right. So they come to see you, they get the exam, and then they go on to their first treatment.
Yep.
Right off the bat.
Right off the bat, yep.
Yeah. And what kind of techniques do you use with acupuncture in, say, the treatment of carpal tunnel?
2 things. I do some palpation first.
Yeah.
So
You're looking for the tender points?
looking for tender point stiffness, if there's any pain in the neck, because
Yeah.
sometimes carpal tunnel can come from the neck. So you have to go to the source of the carpal tunnel. Sometimes it's not from local. It could be from the neck. So if it's from the neck, I will treat the neck as well as the constitutional
Yeah.
and the local points. The needles will go in to the tendons.
Yes.
And most of the time, I will use electricity.
Which is
to
where you clip an electrode on the top
onto
of
the
the
needle,
Yeah.
and that will also increase circulation.
Right. So
Besides
the idea of
needles.
electrical acupuncture is particularly anti-inflammatory, right?
Yeah.
The idea that also that it's not just on the surface like some physical therapy techniques,
No,
but
no.
actually goes down to the level of the tendon,
Right.
where the actual inflammation
Yeah,
or of the carpal tunnel might be, and then you would run the electric stim right alongside that area, and that influences it by giving it an anti-inflammatory action.
Correct.
Yeah.
Correct.
And anything, so you would do that a couple times a week?
Usually we'll have them come in twice a week.
Twice a week?
Yeah, twice. If they can come in 3 times a week, they can recover quicker, but it depends on the individual. But
And do you
twice
use
a week
anything
is
else
good.
in that mix? Any heat lamp or any supplements?
It depends. If there's a lot of heat there already,
Yeah.
I will use a low dose of heat, not too
Yeah.
much. But heat does help the circulation.
So like a heat
Absolutely.
lamp or-
Heat lamp right on that,
Yeah.
and that will increase the circulation and promote the healing.
And what kind of supplements would you use for that?
Probably bromelain. I think that's
Yeah.
a nice supplement. That
So they're kind of herbal anti-inflammatories
Yep.
that
Right.
that we use all the time.
Right, and we have
in
Inflamise
yeah.
at the clinic that, again, it will reduce inflammation so that it can continue to heal, so that the circulation can flow.
And do you have them rub anything into the area on a regular basis?
We can do a couple of things. We can do biofreeze,
Yeah.
or
Which is a simple
Chinese
kind of
liniment.
camphor-based
Right.
liniment. That
Yeah, that will
gets the-
reduce the inflammation because they're going to continuously use
Right.
this part.
Again, like with sports injuries, you can't, a lot of people won't stop the motion that causes it as much
No.
as you coax them
Right.
into it.
Right.
And especially with a work-related injury, if somebody has to be typing and their livelihood depends on it,
Correct.
they're going to be all the way through the
Right,
treatment, they're
right,
going to be
right.
re-inflaming it.
And in addition to the working on their inflammation, you want to also de-stress.
Yeah.
So I would do some points to promote relaxation and calm, and also do the relaxation CD that you
people
have.
don't realize that it's actually a very relaxing experience.
Yes.
You put the needles in, it generates endorphins that gets
Yeah.
people relaxed.
Right.
You're generating your own kind of corticosteroids and natural
Correct.
healing that
Right,
goes
without
on.
having to take over-the-counter drugs.
Right.
Yeah.
And oftentimes, I mean, and you must have had patients, I know I have, I can think of 2 right now. One lady came in and she said, I've scheduled my surgery for my carpal tunnel surgery, which I remember she was a dog groomer. So she was constantly using clippers. And she said, I've scheduled my surgery for 3 weeks' time. And if this doesn't work, I'm going into that surgery. That had a 6-week turnaround. They had to wait 6 weeks before they would have the cast off, before she was able to return back to the clipping and grooming that she did. And I think we did 3 treatments a week for 3 weeks, 9 treatments, and she canceled the surgery. and saved herself a lot of money for the surgery, but also saved herself 6 weeks of lost income as a dog groomer.
Right.
So oftentimes people aren't aware that there are these natural alternatives, non-surgical, non-drug alternatives.
Right.
If we could go to our next slide, it goes back to this idea of, in the workplace, setting things up. So instead of dragging something along, risking injury with heavy lifting, that a simple introduction of a cart can save a great deal of suffering. And then if we go on to our I think you treated that guy in that picture, didn't you, Pheng? Was that one of you? So this guy, even though he looks like he's from the village people, is actually representing worker-related muscular skeletal disorders. And at work, probably a lot more than sports, occupational disorders of soft tissue, so muscles, tendons, ligaments, joints, blood vessels and nerves. So you've got the tennis elbow and the carpal tunnel, the lower back pain, you've got carpet layers knee, all kinds of work-related disorders. What kind of percentage, Pheng, do you, in your chiropractic practice, what kind of percentage of patients do you see are exacerbated by work-related injury?
A large percentage.
Yeah.
A lot of people come in with the tight neck, tight upper back from sitting at a computer all day.
Yeah. So that would cause headaches and other things other than musculoskeletal disorders. Yeah. It can cause all kinds of problems.
Definitely.
Yeah.
Also from sitting down all day. Another really, really big one is low back issues from sitting all day. Sitting is one of the worst things that you can do for your back, and it's the thing people most often do all day long.
Yeah.
And it's hugely aggravating to not only the muscles and ligaments in your back, but also to the discs in your low back. There were a number of cadaveric studies done a while back ago that measured the different amount of pressure in the lumbar discs, and sitting was one of the things that was found to have one of the highest amount of pressure put in that lumbar disc. And that higher that pressure in there,
so in the lower lumbar, does the pressure build the longer you sit?
It does, and what happens is, as you continually sit, that extra pressure in the lumbar disc, namely in the lower lumbar spine, builds to such an extent that it then starts putting little tears into the disc. That added pressure in there, and then you might bend over to pick something up, and then all of a sudden you'll blow out a disc. And it wasn't from just bending over to pick something up, it was from all the abuse that your body has taken before that.
Right, so it's like the straw that breaks the camel's back.
Exactly.
It's not the straw, it's
not the straw.
It's the setup of all those minor tears over years that kind of sets you up for that.
Mm-hmm.
So for instance, I have a patient right now. What would you recommend to her? That she it starts off the day feeling quite good, and then after sitting all day in the office and sitting in meetings, by the end of the day she's in a lot of pain, and that pain translates into sciatica down the leg.
Yeah.
How often do you recommend to your patients that you should get up, walk around?
Every hour.
What kind of stretches should she be doing because a lot of people out there right now have kind of sore backs and are sitting all day. What kind of regime would you recommend to somebody preventatively?
In your particular case, what you're talking about right now, it sounds like a disc herniation, a chronic disc herniation that...
So explain what a disc herniation is.
Sure. When that pressure in that lower lumbar disc that we were talking about, or any disc for that matter, builds, what happens is the inside matter of the disc, it's kind of like a jelly donut, and the inside portion, that jelly portion, tends to want to seep out through the outside part of that donut there. And usually...
Kind of like a jam donut, squeeze.
Yeah.
Which puts pressure on the nerves, right?
Exactly. The disc will herniate and literally put pressure on that nerve.
Yeah.
And, it's a tough thing to deal with oftentimes. And there isn't a magic bullet that's going to be like, hey, this is going to, get rid of it 100%. But there are a number of things that you can do. Namely, don't sit so much.
Yeah. So how often would you say, I've been telling her, set her computer to an alarm so that every hour an alarm goes off, because it's so easy to get sucked into a project on the computer.
It is.
And you're there 90 minutes, 2 hours, and you haven't moved. So the idea of an alarm going off What should she get up and do?
An hour is a good time frame. You know, you should be sitting, you know, every 50 minutes or so. Get up every 50 minutes, walk around for 10 minutes. Walking is one of the best things that you can do for a herniated disc. It gets the disc moving, it gets the disc kind of pumping, if you will, getting some of the nutrients in there.
So a lot of people will get up and madly stretch, and if they got tight hamstrings, they kind of dive into a hamstring.
Yeah.
I mean, that's not good, right? I mean,
not
if you're
necessarily.
overdoing it,
Exactly.
So more gentle stretching. What kind of stretches would you recommend?
It varies for exactly what, you know, what the person has.
You want to demonstrate?
You know, for your patient in particular, what it sounds like would be, what would be helpful for your patient would be to do more strengthening exercises. So McKenzie type exercises for trying to strengthen the low back so that the muscles in the back to help to stabilize the spine without putting so much stress on the ligaments and the discs in the low back.
So what's a McKenzie exercise?
A McKenzie exercise is it's like a physical therapy exercise. Essentially, it's an extension exercise where you know, you're lying on your stomach and you're hyperextending your back to strengthen the muscles in your lower back.
Yeah, yeah. So 5 minutes every hour, walk around, sit down, stretch out a little bit, take a break.
Some light stretching.
Takes the pressure off.
Yeah, absolutely.
Stops the pressure building in the disc. That's actually a great
you know, other things that will help with that patient in particular is a comfortable seat.
Yeah.
A nice lumbar support that's going to take some pressure off.
We have some slides on that. If we could go to our next slide. The idea of awkward positions causing all kinds of problems. So lifting above the shoulders, below the knees, or at arm's length. And we go on to our next slide with some examples of bending, kneeling, and squatting in the workplace. So these postures are really hard on the back and hard on the knees and exacerbate. So the awkward stuff is bad. And then even sitting, it's just not people involved in manual work or in factory work. You know, most office supporters, and on the left we've got the bad news, and on the right we have the good news. The idea of the posture being much more upright. You have the keyboard at a right angle for the elbow. You have, and everybody's sitting up straight in the studio right now looking at good posture and the straight back, maybe a little footrest. So if you're going to be spending 40 hours of every week in this position, you really should take some time to make sure that you've got the setup right. So the computer screen's not too high or too low. And if we could go to our next slide, the idea of a neutral posture as opposed to an awkward posture. So just standing naturally is in a neutral posture, and you can see seated in a neutral posture with elbows at sides, the wrists straight, the feet supported, the shoulders relaxed, the lower back supported, and the head level with the screen not being too high or too low. So those are some of the basics that everybody should know working, you know, and take the time to set their ergonomics of their work site up. It's worth it. And if we come back, we can now see a perfect example of good posture in Betty. You sat up very nicely. But it really is taking that kind of effort in the simple stuff. And because the costs are so great, and if we, the next slide will show us also, if we look at the costs of back care in the U.S. right now, we have $19 billion of lost workers' hours. We have 8 out of 10 actually suffer from back pain in their lifetime. We have the back pain costs are $86 billion a year. 1.2. This figure is pretty astonishing to me. 1.2 million spinal surgeries every single year in the U.S., and 300,000 of them are spinal fusions, and the average cost is $60,000 per spinal fusion. And then the bad news, the failure rate for back surgeries is extremely high. Mm-hmm. There are 50% shown in some studies. So that's pretty remarkable, don't you think, Betty? I mean, when you think of that Canadian study where 1/3 of those people could be prevented from those surgeries, and also then you have 50% of that 1/3 that are heading for, who have those surgeries are heading for a repeat operation or a failure of that operation. That's pretty significant. And
Absolutely,
what we do every day saves people a lot of that suffering. So can you think of an example of back pain that you've
I actually had a patient who avoided surgery. He's a woodworker. He makes cabinets. He works for himself. I want to say he's in his 60s, probably 65, and he came in, barely could stand for a minute or two. Put him on the table, did the intake, ascertained what the pathological concern was.
So in Chinese medicine, just interject, so for instance in Chinese medicine, he could have been reaching awkward, in some sort of awkward work posture as a woodworker. Constantly. And then on top of that, there might have been some structural problem, and then on top of that, within the Chinese concept is if there's some sort of internal deficiency of the kidney energy, that would also set him up
because of his age.
Yeah, so the Chinese would work.
There's definitely a kidney deficiency.
50% of it would go, of your treatment might go towards helping him internally to help his energy recover.
Organ, the function.
And then the other percentage might go to help with the
circulation, the stagnation of
so
qi
how did
blood.
he do?
He did great.
Excellent.
So he didn't have the surgery. He does have to come in for maintenance, though. So because of his age, because if he wants to continue to work, he's on maintenance where he comes in.
So for instance, in his life as a woodworker, self-employed, hopefully his insurance would cover him for the $30,000 to $60,000 of the surgery cost. But then the recovery time, not being able to work.
Right, unable to work, and there's a failure rate of 50%. So he may come out, not be able to work, and still feel bad.
And be complicated further.
Correct.
So how did it look for him? So did you see him twice a week, 3 times a week?
I saw him twice a week.
Twice a week,
for 12 sessions. And then he actually did really well. So I would say that, just thinking back, his pain was reduced by 50%. I want to say probably at the 9th visit. And then we continue to work. So he came in for 12 sessions, and then we would space out the treatment. So now he comes in once a month to maintain.
Great. And was there any electrical acupuncture, regular acupuncture?
Basically, increasing circulation in the lower back, doing direct local points as well as distal points. Absolutely. I did electrical acupuncture on it, the heat lamp, because we want to increase circulation, because already the chemical steroid is reducing the inflammation. And after that, we did some cupping. Cupping is they're glass cups, and you use heat to create a suction on the skin, and that helps the circulation.
So all of those techniques basically reduced his pain. Yeah, because I had read a figure that 70, Pheng, maybe you could address this, 70% of all herniated discs do spontaneously pull back in if they're able to be brought out of sprain or strain or inflammation. So if you can facilitate the inflammation being cleared from the area, that spontaneously they can pull back in. A lot of surgeries, right, are, another figure I saw was that over a 2-year period, intervention versus non-intervention with herniated disc was about the same. The only differentiating factor was the amount of pain. Somebody will do the surgery to get out of pain. If they're at 50% less pain, then they can go through that 2-year period and the body will heal itself, then they avoid the surgery. So what do you say to that? You want to know what my sources are?
Regarding what you were talking about with, getting people past that couple-year point, that is a huge deal, because you are right. If you can get someone in less discomfort, they're not going to want to pursue the surgery. It's about keeping them relatively pain-free in that interim.
Right. So the chiropractic, looking after the armoring of the musculature, looking after the structure so there's not greater pressure put on certain vertebrae, all of that works towards that end of getting somebody more comfortable.
Exactly.
Yeah. I said it for you.
Yeah.
So we could see our next slide. This is more, most people aren't aware that, acupuncture is as prevalent as it is with, and there's some studies. Here's one that shows that 10 acupuncture treatments a week provided over the course of 8 weeks in this study compared the usual care with acupuncture and had a beneficial but also persisting effect. It wasn't just getting them out of the acute phase. In another trial, 1,100 patients with chronic lower back pain that had lasted for an average of 8 years, so a very chronic situation. Almost half who received acupuncture showed significant improvement. And I was thinking about that today. I mean, that's pretty intense. If you've been in back pain for 8 years, then acupuncture can still get those 50% of those people significant improvement. That's pretty good. And another 6-month study revealed that acupuncture is more effective than conventional methods for treating lower back pain, and that 57% of rheumatologists and 69% of pain specialists are now referring to acupuncturists. And then on to our next slide, for chiropractic and back pain, a group of chronic lower back patients underwent chiropractic treatment, showed higher pain relief and satisfaction than conventional care. And a study in 2005 showed that the cost of chiropractic care, in one study, that the chronic lower back pain with chiropractic care being more effective. And there's a picture of our Pheng, very studiously at your x-ray in your office there, Pheng. So in conclusion then, just the idea of using more natural methods, like chiropractic. And most people think of chiropractic as snap 'em, crack 'em kind of treatments, but that's a bad characterization, because a lot of what you do is quite subtle work too, right? Would you say? Working with the musculoskeletal system.
Yeah, that's. I particularly do a lot of soft tissue work just because that's kind of what I like to have done.
Yeah.
When I go get my treatments. When you make an adjustment on your spine, working around the soft tissue will really help to hold that treatment, if you will.
Yeah.
And really not doing yourself the full service if you don't get everything worked on at the same time. You're just kind of not really helping yourself out as best as you can.
Right. If we could go to our next slide. Because herbs are also great access, having access to natural anti-inflammatories instead of non-steroidal anti-inflammatories, like Motrin, Aleve, and, Advil and Nuprin. That non-steroidal anti-inflammatories in a study in 1999 showed that there were 16,500 deaths, mainly elderly people bleeding out from the chronic use of these non-steroidal anti-inflammatories. So there are much better, subtler, natural alternatives, such as bromelain, which is a potent anti-inflammatory. It's an enzyme. We use it. It's part of a formula, Wobenzyme, that has a collection of different enzymes in our office. And if we go to our next slide, to basically conclude, the idea that chiropractic is very helpful, but also exercise is particularly crucial to keep the muscles strong and flexible, stretching, correct lifting and moving techniques, maintaining upper body weight, trying to keep the weight down so that it doesn't put a strain on the structure or on the back muscles, avoiding smoking, making proper posture when standing or sitting, not slouching if you're sitting for long periods of time, and maintaining a correct weight. All of these factors are something that people can do themselves, and then if it becomes a problem, they really should be considering acupuncture or chiropractic or herbal anti-inflammatories to help treat some of these problems before considering, steroidal injections or surgery. So I want to take the time to say thank you very much for joining us tonight on our program on back care. My name is Geoff Darcy. I'm an acupuncturist herbalist at the Darcy Wellness Center. I want to say thank you very much to Betty Wu, acupuncturist, and to Dr. Pheng Kouch, chiropractor at the Darcy Wellness Center. And thank you very much for joining us tonight.